I'm Joe Augustinelli, Social Media Manager at Greenway Health, and this is Putting Possibility into Practice, the podcast from Greenway Health. And today, I am joined by David Heller, Corporate Counsel at Greenway Health, who manages regulatory affairs. David, thank you for taking time out of your always busy schedule to sit down with me today.
Thanks, Joe. How are you?
Good. How are you doing today?
I'm doing great.
Probably have one of the busier jobs in the industry, keeping track of regulatory affairs and just everything that is going on in the healthcare industry.
It's quite busy this season, that's for sure. We're entering spring, which will be a lot of rulemaking, and recently we've had a lot of announcements that will be taking up a lot of our time, and also stuff that the providers in different organizations should be looking at too.
And one of those announcements that providers should be looking into is a recent announcement made by CMS Administrator Seema Verma, and you're here to talk a little bit about that today.
Right, so a couple things to look at here and to backtrack. So recently we had an announcement by Administrator Verma, and just earlier we had an announcement from Secretary Azar where they're looking at the delivery models, and the way they described it is they are not afraid of being disruptive, and they are going to pursue a lot of change rather rapidly. And what they're really honing in on is cost of patient care and trying to empower patients. And in fact, after Azar's announcement, we saw some immediate action from United Healthcare and the way they're looking at doing business. Even more recently, Secretary Verma announced another initiative today that was really pinned against two things. One was interoperability, or the sharing of clinical information, and the other is burden reduction for clinicians. So a couple things to unpack there. First, they're looking at how can we make the data flow better, and that touches technology vendors, it touches private plans, it touches also provider systems. And what you might see for providers coming out of this is changes to the way we measure the use of technology. You could see this work into clinical quality measures. Under macro, you may also see it work into improvement activities, and also meaningful use in advancing care information, which are the traditional levers by which CMS tries to encourage interoperability. The other thing they're looking at on the other side is how can we make coding a lot simpler? So they're looking at streamlining evaluation and management coding, which has been a pain point for many organizations in the past. The other thing that they're looking at is clinical quality measure workflows, and they've been very open about this for a while. This is really an outgrowth of their Meaningful Measures project, which kind of grew out of the administration's Patients Over Paperwork project. So this is continuing a trend we've seen. A couple to-dos, I would think, for provider organizations. They've signaled that they really want to push 2015 certified EHR technology next year. So if I'm a provider organization, that means to me I should probably start planning my upgrade, so that way I'm not caught in a more arduous year trying to do change management implementation of a new EHR edition that has a lot of new certified and robust functionality. The other thing I would note that I would encourage providers to do is CMS and also the Office for the National Coordinator of Health IT are really engaged a lot in listening modes right now, and are very much trying to hear out provider communities. So when they solicit comment and they solicit your input, I strongly encourage you to provide that input, because they are very much listening, right? So a lot of people have become cynical by looking at the programs of the past, feeling like they weren't necessarily heard. I think you can see a lot of learnings from those past experiences by our agencies and the people running them. And when they open up for comment, really make sure that your individual voice is heard and pitch in.
And in talking about individual comment and making your voice heard, I take it there's ways to do that on the websites or through digital media now?
So frequently, whenever ONC will do something, they'll open up a comment page on their website. Most recent example was the Trusted Exchange Framework and Common Agreement, and they solicit input directly on their website, or you could email them. With CMS, sometimes they'll open up comment on individual things through their website. Other times, all of this is going to go through proposed rulemaking, and we see that every year during the spring. And they solicit comments and tell you exactly how to comment. Usually it can be mail-in or email, and strongly encourage to go through that process as well. The agencies read every single one of these, and they take them to heart, and they are trying to counterbalance, a lot of different voices in the industry. but if your voice isn't heard, they just don't know what your perspective is. The other way I would keep an eye on things, subscribe to the ONC's listserv and CMSs, especially at kpp.cms.gov. You can get updates on that subject and others that might interest you. I use them and find them to be fairly timely and informative.
And on these comment periods, is there a standard as to a set amount of time people have to comment, or do they usually let providers know what the deadline is for comments?
So it's always going to vary from rule to rule. And what they do in the first 2 pages of the rule is they'll tell you comments are due by date X. Depending on the size of the rule, comment period could range from 30 to 90 days. With macros regulations and through the quality payment program, you generally see around, I'd say, the 45 to 60 day mark. But it depends on each individual rule, and generally speaking, it's in the first 2 to 3 pages of when the date is.
Great. I want to once again thank my guest, David Heller, for taking time out of his schedule to join me today. David manages regulatory affairs as corporate counsel for Greenway Health, and we always enjoy his time here on the podcast. I'm Joe Augustinelli, social media manager at Greenway Health, and this is Putting Possibility into Practice, the podcast of Greenway Health.